This study investigates the complex relationship between heart rate, hour, and body temperature, BT, in critically ill pediatric patients admitted to the Pediatric Intensive Care Unit, PICU, using machine learning, ML, techniques. The objective is to identify subtle patterns and dependencies within the dataset to achieve this objective. The study utilizes a large database of 4,006 children, with HR and BT records available, collected through continuous monitoring at 1 second to 5-second intervals and manual measurements taken every 24 hours. The data collection process involves varying measurement methods based on patient age, including rectally, esophageal, or axillary temperature probes for BT and electrodes on the patient's chest or pulse oximeter attached to the patient's finger for hour. Gradient boosting machines, GBM, implemented with Quantile regression, QR, is identified as the most fitting model, effectively capturing the nonlinear relationship between HR, BT, and age. The results demonstrate a declining trend of HR with age, while HR increases with BT. A user-friendly interface is developed to generate HR predictions at different percentiles based on 3 key input parameters: current HR, current BT, and patient's age. The study challenges previous research's presumed direct linear association between HR and BT, emphasizing the importance of reconsidering traditional assumptions in clinical contexts. The findings highlight the need for age-specific considerations, centile charts, and flexible modeling approaches to improve clinical assessments and guide medical interventions. The data pre-processing step involves several tasks to ensure data quality and reliability, including excluding data from patients who have moved, normalizing body temperature data, and excluding extreme values of heart rate. The dataset is further segmented into age groups according to the Food and Drug Administration, FDA, standard age categorization, allowing for a more nuanced analysis of temperature variations and age-specific patterns in pediatric patients. 4 popular machine learning algorithms, including conventional linear regression, multiple linear regression, polynomial regression, and support vector machine, are used to capture the intricate relationship between HR and BT, predicting the dependent variable, HR, based on the independent variable, BT, and age. Here is the combined summary of pages 58 of the research paper. This study explores the relationship between heart rate, hour, and body temperature, BT, in children admitted to the Pediatric Intensive Care Unit, PICU, using machine learning, ML, and deep learning, DL, approaches. The research leverages an established equation that shows BT as an independent determinant of HR, resulting in an approximate increase of 10 beats per minute per degree centigrade. The equation includes coefficients for BT, age, and age squared to predict HR values. To further investigate the relationship between HR and BT, the study employs Quantile regression, QR, a statistical method that estimates the response variable at various quantiles, along with traditional ML algorithms and DL models. The performance of these models is evaluated using R-squared, mean square error, and quantile loss metrics. However, traditional linear regression models struggle to capture the complex relationship between HR and BT, as evidenced by low R-squared values and high mean squared error loss. The authors then explore the use of QR with ML and DL techniques as a linear and nonlinear kernel, motivated by the potential nonlinear correlation between HR and BT. The results of the QR analysis reveal that the lowest quantile loss value is obtained using gradient boosting machines, GBM. The total quantile loss calculation demonstrates that QR performed with GBM outperforms conventional approaches with linear kernels. The predictive capabilities of the best-performing model are visualized in figures, showcasing the model's proficiency in forecasting HR at multiple quantiles and predicting HR for specific quantiles with respect to BT variations. A simple user interface is developed to enable clinicians to utilize the QR prediction model, which processes 3 input parameters: current HR, BT, and patient's age, and outputs HR predictions across various percentiles tailored to a specific patient. This clinical decision support system has immense potential for integration with an existing data representation and can help caregivers with clinical decision-making. This research presents a novel approach to understanding the relationship between heart rate, body temperature, and age in children admitted to pediatric intensive care units. A meticulous multi-stage data pre-processing strategy uncovers complex patterns that conventional models might overlook. The findings confirm the expected downtrend in heart rate with increasing patient age, but the nuanced approach of grouping data by temperature rather than age allows for a more granular exploration. The performance evaluation of various machine learning and deep learning algorithms reveals insightful results, with quantile regression performed with the gradient boosting machine model showing superior performance in capturing nonlinear relationships across a broad body temperature range from 33 to 40.9 degrees Celsius. The heart rate model predictions demonstrate a downward trend with age and an upward trend with body temperature between the 5th and 95th percentiles. The proposed model uses quantile regression to predict the 5th, 25th, 50th, 75th, and 95th percentiles of heart rate for a given body temperature and age, providing healthcare providers with a decision support tool to aid in diagnosis and treatment. The model is integrated into a clinical decision support system, which will provide real-time predictions of normal heart rate ranges based on patient age and body temperature, enhancing diagnostic accuracy and treatment efficiency in pediatric critical care settings. The study highlights the potential of machine learning techniques to decode intricate associations in critically ill pediatric patients, enhancing prediction capabilities and holding promise for early detection and developing more personalized and effective therapeutic interventions. Future directions include observing a cohort of subjects upon whom clinicians have implemented interventions guided by the predicted heart rate model and exploring the interplay of variables, focusing on gender-based differences. The authors also acknowledge limitations, including the need for further validation of the model on a larger dataset and the potential impact of other factors on heart rate predictions.